Rhonda Rothschild and her husband depend in part on Medicare to pay for the routine.
Take a deep breath.
And to pay for the serious.
Pneumonia, bronchitis. He was pretty sick.
Dr. Richard Hayes of Wellington has nearly 1,000 Medicare patients, making up a third of his business. He gets reimbursed by Medicare for the treatments that he provides patients. But unless Washington can cut a deal to avoid automatic spending cuts put in place by their last budget deal, Medicare payments to doctors will be cut by 27%.
Just like any other small businessman, we really have no way to absorb that kind of a cut.
As a way of protecting patients from financial burden, Medicare's rules prohibit doctors from turning to patients to make up the cost for what Medicare doesn't pay. If the nation goes over the cliff, Hayes says treating the elderly who depend on Medicare will be all but impossible.
Our practice, and probably a lot of practices, would just have to find a way to not see any Medicare patients anymore.
We spoke to Congressman Ted Deutsch by phone, who says an overall deal seems no closer, but that Congress should hold a vote on no-brainers like Medicare reimbursements right away.
I remain hopeful that the consequences, as significant as they are, will cause us to come together to at least address the things that have to get done before the end of the year.
With her health care hanging in the balance, Rothschild had harsh words for all members of Congress.
They're trying to stick it to us, and it's not right. I mean, we send them to do a good job, and I don't think a lot of them are.
Their next vote could save someone's life. In Wellington, Evan Axelbank, WPTV News Channel 5.